Welcome to the 68th Annual AHCA NCAL Convention. We are lucky to have Stephen Hanse from New York State Facility Healthcare Association, President and CEO. How you doing today, Stephen?
I'm doing fantastic. It's a pleasure to be here. Thank you.
Great. We're so excited to talk to you. We know that you're new in the role.
Yes.
And we have a lot going on in New York.
New York is never a dull moment. I joined our association in 2013 as Vice President and Counsel, and from that day forward, the regulatory and legislative issues facing long-term care providers in New York has not let up one bit. Payment issues, managed long-term care issues, value-based payment issues, really just continue to move forward in New York as New York really tries to lead the nation, if you will, in terms of changing the paradigm of long-term care.
And I will tell you, I have a lot of clients in New York, and New York is exceptional. They are ahead of the curve. They're ahead of the rest of the country on a lot of areas. And particularly, I would like to talk about case mix, which is managed Medicaid or Medicaid, and bringing in the value-based purchasing component. So there are only 34 states that have a RUGs-based Medicaid system. But now you're telling me that your case mix is bringing in value-based purchasing?
Yes, New York State, we've transitioned to managed long-term care on the Medicaid side from a fee-for-service based system. With that, the state is transitioning to, they have entered into an agreement with CMS to really move the system to a value-based payment method, VBP1, VBP2, and so on. So they're linking a lot of the payment methodologies moving forward to those VBP levels, which is difficult.
And so this morning I spoke, and for those that don't know, value-based purchasing has three components: a measurement, a report, and a reward. A measurement for Part A is hospital readmissions. The report needs to be transparent for the consumer, and the reward is 2%. Tell me, for case mix, New York case mix, what is the measurements for their value-based purchasing?
Their measurement, well, it's a process and they're working through, and it's interesting because when we look at VBP1 and we're looking at our members and on those measurements and how many at the present time can meet these standards, we're really looking at about 5% right now of providers in New York State. Right now in New York State we have about 629 long-term care providers. So it hasn't fully taken effect yet. It's a process the state's trying to transition through for the Medicaid population, for payment, which is a very difficult time for us to work this through.
Right.
This in the face, as I mentioned earlier, but really, we're facing the changes on the federal level with the potential for Medicaid cuts that we were working closely with AHCA on that issue. In the state, in addition to managed care issue, it's very difficult. While we have relatively strong census numbers, New York unfortunately leads the nation right now at a $56 per day per patient per day shortfall on the Medicaid side. It's been 10 years since providers in New York State have received a trend factor, a cost of living increase. So our members, we are working diligently in this environment, this very cost-conscious environment, to really ensure that we provide the high-quality care in the VBP, future environment.
And that Medicaid shortfall is significant. So a provider will not be able to survive without other payer sources, given that. A $56
Absolutely.
PPD is intense.
Absolutely. The only way we really can survive, generally speaking, is with the Medicare and the private pay. I mean, roughly about 76% of our members' population is a Medicaid population.
So let's talk about something else. We've got the regulatory component as well,
Yes.
and the requirements of participation,
Yes.
and having. How are your members feeling about completing the expectations? Are they overwhelmed? Do they have any insight into some ideas? How are they dealing with it?
It's a difficult one to deal with. We're working with AHCA on the national level to really bring attention to the costs and the impositions on that. We're actually working, our members and the association is working with the Department of Health on the new survey regulations under the requirements of participation. They're going into effect November 26th. We're working with the department to help them train our members because it's really kind of a black box. So we've reached out to the Department of Health as they train their surveyors on the new requirements to be able to train our members so we know in partnership with the department what the Department of Health in New York State will be looking for with our members. That's one of our biggest concerns, really. The survey process, unfortunately, tends to be, and I would argue it shouldn't be, from time to time, it tends to be an adversarial process, which really it should be a partnership where we all have the same goal in mind, high quality, to ensure better care for our members. So that's one of the things on those survey requirements that we're working with them. So our members have a clear indication with the department of what they will be looking for and how to work to make this better and make this transition work.
That's great. Well, we're grateful for NYSHFA, New York State Facility Health Association, and I could have said it wrong with the acronym, but you're a great organization and you're working diligently, as you said earlier, to represent your members and give them what they need from a regulatory and reimbursement perspective. Thank you so much.
It's been a pleasure. Thank you.
Thank you very much.
Have a great day.
Great.